great introduction. If we can advance the slides. And the next slide, let me just summarize then very quickly what we have in front of us. We have a problem on the one hand of not enough Americans having coverage, and the reason for that is it's hard to find affordable coverage. So the cost of care fundamentally is a major problem. And Congressman Walz has already shown you the inexorable rise in the rate of premiums for those of us who have insurance through our employers, as well as the rise in Medicare spending. So as we look at this, our concern is quite simply that we are not getting value for the money spent. We are spending trillions of dollars on healthcare in the United States currently, and that cost is projected to double between now and 2015. The estimates may actually be, unfortunately, too soft, and we might see the doubling way before then. The next slide actually shows you a geographic representation of spending in the United States.
Where's my tippy?
Now, what?
The slide's too low.
Where's your bag?
Can they move the projector up there? Is it set in the ceiling?
So what's important? What's important about this slide is the color of the states. This is Medicare spending per enrollee in each state. The light-colored states are the most efficient from a cost perspective. It turns out they also have the highest quality. The dark-colored states have the highest spending, they're the least efficient, they also have the lowest quality. Now, let me just suggest to you what the impact would be. So if you consider that in the light-colored states, we're talking about annual spending on the order of about $6,000 per person per year. And in the dark-colored states, we're talking about annual spending that is on the range of about $13,000 to $15,000 per person per year. If we paid everybody in the United States the same amount for care that we paid Mayo Clinic, as we paid the doctors in Wisconsin, Iowa, the Dakotas, Montana, we would reduce our Medicare spending by 30% per year right off the bat. The problem of how to find coverage for those who are uninsured would go away pretty fast. The problem of trying to make sure we can finance affordable health care for everybody else would be manageable pretty fast. So we started on this work more than 2 years ago in terms of trying to understand what we could do, and it became very clear to us on the next slide that the status quo is not an option. The status quo is not an option. We simply have to find ways that we can do better. It is not sufficient to achieve just insurance reform. It is not sufficient to work on delivery system reform. The insurance reform might be easy. I think the delivery system reform will be harder, but that will require considerable leadership from within inside the medical profession. And we in particular believe that there is still a great opportunity for us in this country to achieve what might be considered a bipartisan solution. But we have to achieve a solution that has to come back to help individuals. So on the next slide, if we would consider for a moment, what is it that this means, even to me as a person who is insured at Mayo Clinic, we need to make sure we understand that the goal of this effort is to create security for each one of us. The Mayo Health Policy Center has a strong sense that we should have affordable insurance for everybody. It should not be dependent on you having a job or losing a job. You should never have to worry about that problem. It should also mean that you can be sure of getting the best care that you can every time. I'm not paid by how many things I do, I'm paid a salary. The only important thing for me is what do I do to get things right for an individual. Everybody in the country should have comfort in the fact that they're getting high-quality care and that their doctors will be rewarded for doing high-quality care, not just doing more, as has already been suggested by Congressman Walz. And that will bring us to more affordable care. So on the next slide, I will articulate two simple goals. In order to achieve high-quality, affordable care for all Americans, we have to have both insurance reform and delivery system reform. One, and not the other, will not get us where we need to be. The next slide considers how we think we could improve the insurance market, and in that circumstance, this reform should incorporate affordable insurance for everyone, There should be no exclusions for pre-existing conditions. The government has to find a way that it can afford to provide subsidies for those who can't afford insurance. And we think there are already a number of great options. So we've talked about, for example, the public option. There are several public options now: the Medicare program, Medicaid, the Veterans Administration programs, Department of Defense TRICARE program, and there's the Federal Employee Health Benefit program. This is the program that members of Congress have. It works very well. There's no exclusion for pre-existing coverage. There's prescription drug coverage. There's a basic benefit set that's fairly comprehensive, and there's tremendous choice. The next slide is perhaps for us in the profession the most daunting, and that is how, in fact, we can achieve delivery system reform. Although it is often said that payment policy is a blunt instrument, it also is an instrument that does get doctors and hospitals' attention. We do respond to that. In fact, that's one of the problems with current Medicare policy. We tend to do lots of things we shouldn't do. We all respond to that because there are lots of rules that say you have to do it this way. You were saying, did somebody read the bill? It's 1,100 pages. Let me tell you that every year, the rule that describes how Medicare is going to pay me as a physician is 1,100 pages. And I have to read it twice because it comes out with a proposed rule, and it comes out with a final rule. So I got to read 2,200 pages. And that's about 100 pages bigger than the biggest textbook of cardiology. I'm a cardiologist, and I can tell you I don't read a textbook of cardiology every year. At any rate, we think there are better ways to do this. This will be a huge political challenge as well, but as we've earlier in the invocation talked about courage, Representative Walz has demonstrated great courage already in trying to move this through the Congress. We are hoping that we will be able, in this circumstance, to get the Congress to understand that the payment system simply has to change to get to value, not volume. And that's really an uphill battle, and Congressman Walz has been on the front of that steep climb, and we appreciate his courage and commitment to that. So I'm going to stop.
Daddy, say what?
If we can put it back, thanks, Doug. We're going to go with some questions. If we could go one more slide, no, one more, they're right here. And I want to tell you what